Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Hey there, Dr. Grove. This is Dr. Marc Darrow, and we're going to be talking about ankle and knee pain right now with Jim. So, Jim, can you hear us okay? Jim, are you with us? Hello, Jim. You can hear me good. All right, this is Dr. Marc Darrow. We've also got Dr. Thomas Grove here.
Hey, good morning, Jim.
We're regenerative medicine specialists. I've been doing this over 27 years. Dr. Grove's been doing it for a dozen years. We inject with stem cells and platelets, and you're talking about your ankle and your knee that bothering you. May I ask first, how long has that been going on? Which one came first?
The knee came first, and that's been going on for about 10 years, and about 2-3 years with a peroneal tendon in my ankle.
Okay.
And I kind of have three questions, I more than three, but I'll limit it to three.
No, you can ask as many as you want. We love you.
Thank you. Do you do the work on, I've been listening to your program for years. Do you work, I know you do work on meniscus, but do you work on peroneal tendon?
Yes, we deal with those almost every day of the week. And it's a very easy fix in most cases. The worst one I've ever seen was a tear in a ski instructor, and her career was over. She came in, she could hardly walk, and the peroneal tendon, which is on the outside of the ankle, underneath that lump, right? What's that lump called, Dr. Grove?
It's called a lateral malleolus, so it's kind of that outside bump towards the end of your ankle there. But yeah, this is a very common tendon that we see injured. Again, the beauty of musculoskeletal ultrasound is I can pinpoint exactly where to place that needle, because it's not a huge tendon, right? But we make sure we're not dinging up any of the vessels or the nerves that run in that area as well. But very common area.
You got to be careful there.
Yeah.
So anyway, this woman comes in, and the peroneal tendon was so hypertrophied, meaning grown, and out of place, it looked like a pinky finger was lying around that lateral malleolus, which is the lump at the end of the fibula bone. Okay, there's two bones in the lower leg. And she said, do you think I can get back to skiing? And I said, I don't know. I've never seen one this bad before. I don't know. So we did a couple of injections. We typically will do an injection when the patient comes in on the first day if they want to do that. And then we have them come back 2 weeks later to check up on them, see how they're doing. She came back, it had already shrunk about 50%, and her pain was about 50% better. And we did it again. She came back 2 weeks later, it had completely healed. It took her a month to heal, and she was back to skiing again. She said it changed her life to be able to get that back because her family was all skiers, the kids were skiers. She loved teaching skiing. And that's how miraculous this can be. I mean, it was like one of the most amazing things I've seen. And we have to be careful. We tell every patient that there are no guarantees to healing no matter what modality you use. Stem cells and platelets are not a guarantee to you healing. So when people, everyone wants to know when am I going to heal? Is it last week or the week before am I going to heal? We don't know if you'll heal. And we have people actually sign a consent form that says there's no guarantees. So be careful whichever doctor you go to for any kind of treatment if they say, especially if they say we're going to operate and you're going to get better, because we don't know. We see all the failures in surgery, so we have to be very careful about that.
Yeah, pain is very subjective, right? So anytime that you're dealing with somebody who's guaranteeing a specific timeline or a specific decrease in pain, just not being honest with you or doesn't have the clinical experience, right? I mean, there's tons of research saying, hey, we know this heals tissue, but really what we're going for is a symptomatic improvement, right? You don't really care what the image says. You care about how you feel. And how you feel is going to be different for everybody. Sometimes you need more than one round of injections, right? Sometimes you need a little more time. We give great stories of people healing very quickly. And Doc and I, we heal pretty quick after injections, but some people don't. Some people need a little more time to offload that area and heal up. Everyone's a little different.
So
This
does
brings
that
me,
answer?
Thank you. Those are good stories. It brings me to my second question,
Sure.
which is I can walk fine with my two problems, but I'd like to run, and it is limiting me from that. Do you recommend that I kind of get a treatment as soon as possible, or wait till it gets worse? I think I know your answer, but I'd still like to hear it.
No, I don't really have an answer because it's always patient directed. It's really what the patient wants. We don't tell people what to do. We never do that because we don't like people coming back at us pointing their fingers and said, you said blah, 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 when they didn't listen anyway. Patients don't listen to us very much. So we have to be careful that we put out the truth the best way we know it, which is to be conservative, let the patient do what they want, and we tell them what we think would work the best. In your case, I don't have an answer for you. Because if it's my body, typically if I want to go running, I want to feel good about it. So I'm gonna inject myself. And I've injected, if you've been listening to the show for years, you've heard me say I've injected both my knees, my right wrist, I've injected both my elbows, both my shoulders. I've had to have other people inject my neck, my whole entire spine, my back, all my ribs. And you might say, well, why do you have to inject yourself so much? The stuff can't work then if you have to inject yourself so much. No, that's not true. It's worked on me every time. It's just that I am a ballistic athlete. I don't look that great. I don't look like Dr. Grove. I don't have his musculature or anything. I'm just a regular, nerdy athlete. But I was a gymnast when I was young, and even when I was really young, when I was a little guy, I ran everywhere. I just have a lot of energy inside of me, and I take it out on sports. So by the time I was by the way, I'm 76, and by the time I was in my 40s, I couldn't do anything. I was so miserable with pain all over. And then I learned about this at a conference on what's called prolotherapy, and I allowed a doctor to inject my wrist. It was 50% better overnight. And then I injected a couple more times myself, and I learned how to inject myself. It's no big deal. So what about your knee? What's going on with that? And by the way, Stephen, we're going to get to you also, so don't hang up on us. And we have some other callers coming in. So, Jim, what's up with the knee?
Yeah, years ago, maybe about 10 years ago, maybe even more, I had an MRI, and they diagnosed it as a kind of a stretched meniscus, not so much torn.
Okay.
And like I said, I can walk, it's fine, but running, sometimes it flares up. Sometimes I can run a little bit, but I sure like to do better. So I've been kind of avoiding it for that reason. And also, honestly, I have a buddy who had an injection for his elbow, and boy, he complained about the pain a lot. So that's kind of an ancillary question I have with you about.
Sure. Well, Dr. Grove, do you want to address that?
Yeah, so again, with knee pain, proper physical exam, ultrasound scan, there's a lot of structures around that knee. It's pretty rare that it's only one thing that's causing pain for somebody, especially if you're a sprinter or a runner. We want to make sure that knee's feeling stable, feeling strong, and again, seeing exactly what structures are involved. But again, a hands-on physical exam, ultrasound scan will give us more information. Also,
when you talked about your friend having pain with the elbow shots, when we do injections on an elbow, we use what's called a 30-gauge needle. It's like a feather. It's so thin. Does it hurt? It doesn't tickle because shots are shots. But we're very, very cognizant because we've injected ourselves. I probably have injected myself more than any human on the planet for musculoskeletal pain.
I was telling a story to one of the patients yesterday. I had a mentor who made us inject ourselves with 18-gauge needles without anesthesia, which is kind of a large needle.
Good. So you know what it feels like.
So you know what it feels like. So that way, when you're actually injecting people, you want to give them the smallest needle possible. It's like Doc's saying, we're very conservative. Again, I use ultrasound so we can aim where we're going, but it's a lot more comfortable than people think it is. You're still getting pokes, but it's as small needles we can use. And
for someone, we do get people who are needle phobic, and we can give them something like a Xanax to relax them. We can also use a numbing cream. We rarely have to do this, but we did it once last week, I think.
Last week we had one. Yep.
We had one person that said, I'm really needle phobic. I don't like any pain. And I said, okay, we can numb it up. We can also inject first with a teeny needle with some lidocaine. before we inject the PRP, the platelet-rich plasma, or the stem cells. A lot of things we can do to help that, but we rarely have people say it was really painful. Once in a while we'll get someone who's really sensitive who'll say, yeah, that was painful. But I can tell you from my own experience, and I've injected myself hundreds of times, that it's not a big deal. And I'm not any tough guy. You know what I mean? So
yeah.
I don't.
Well,
we
that's
just
encouraging.
Don't, yeah. So
yeah,
Jim,
I'm needing some motivation to do it, and because it's not terribly disabling, but I sure would like a little better quality.
Well, I can't guarantee you anything, but I'm going to guess, because I can only guess from what you're telling me. It's not that bad, and we can help heal you up so you can run and you can sprint pain-free. And how do I know that? Because I'm the guy that had that. I had 45 cc's of fluid in my right knee, and I was on crutches. And I injected myself with stem cells 4 days in a row. And guess what? I'm back to sprinting again. I'm pain-free.
That's good. That's good hope.
And,
good.
I've just had great success. When I was a real dummy, when I was in med school, I had a shoulder surgery because I didn't know any better. I never needed it, but it screwed my shoulder terribly. And I had 4 years of misery. I finally learned about this, injected my own shoulder. It healed 100% overnight, 100% full range of motion, zero pain. And at that point, I knew this was going to be what I'd do the rest of my life for medicine. It doesn't always go like that. It's like Dr. Grove said, he and I heal quick. But some people take a long time to heal. We just never can predict that. Anyway, Jim, we're going to go to Stephen and then to Hector. And I appreciate your call, Jim. God bless you. And Stephen, we understand you also have a knee problem. How long has it bothered you?
Going on 2 years now.
Okay. And what did your doctor tell you about it?
Well, first of all, I want to tell you I'm a former patient of yours. You did stem cells on my shoulder, and it was actually a very positive experience. So
wonderful.
That's why I'm coming back.
Okay.
This was not a major injury at all, but I started having a lot of pain in my left leg, my left knee.
Okay.
I'm a golfer. I couldn't get down to squat in order to sight my putts.
Oh, I hate that.
Yeah, it was awful. I was.
Guess what I was watching last night, drinking a beer after work? Full Swing, Netflix. Have you seen it?
Yeah, I understand. No, I haven't.
Oh, you have to.
So I had a small tear in meniscus.
Yeah.
My doctor tried to treat me. It was Kaiser, and they unfortunately seem to be withholding services rather than delivering services these days. It took me quite some time to get an MRI, and then finally they did a little arthroscopic surgery and took out some meniscus.
Yeah, that's awful.
And I was fine for about 2 months. Now it's back hurting again. They're telling me it's arthritis. I'm grade 3 on a scale of 4, whatever that scale is.
Sure.
They just want to inject me with cortisone, and I've refused it.
Good.
And so I don't know. I mean, I'm still having problems in the same exact area. I've done all the physical therapy. I don't know. Can stem cells help with arthritis? Oh, and by the way, I have a small bone spur at the top of the left side of my knee, which is where I'm having some pain as well.
Okay, so let me address some of that. Then I'll get Dr. Grove's 2 cents on it too. Number one, it sounds like, I wasn't there to watch all this, that you had a surgically induced arthritis, which is so common. They went in to correct a small meniscal tear, and I don't know how they were going to do it. Were they going to suture it up? Probably not. Probably remove the tissue, which is terrible because you need that for the integrity and support of the knee. And then they probably went in and they saw some tissue that was, what they're going to call excess and not in place, and they cut it out. And then you end up with arthritis, immediate arthritis. So I'm not for these surgeries, and the studies show over and over and over, don't do these knee surgeries because you end up worse. And then the cortisone, there's studies on that show that it destroys the cartilage. So why are they doing it? I don't know.
Doctor, to be fair, they did see arthritis in there before they did the meniscus surgery. Not quite as advanced as it is now. So maybe it's 6 of one and half dozen the other.
Like I said, I wasn't there to watch, but I can tell you because I've been watching these things for close to 30 years. people go in, let's say with an ACL rupture, okay, the anterior cruciate ligament in the knee, a rupture. They get a surgery. The surgeon says, God, it wasn't even ruptured, but I had to do a clean out. Dr. Grove, tell us what a clean out means.
I mean, when you're in there with a arthroscopic device, basically you're just looking at the tissue. Anything that's kind of not firmly attached where it should be, and it's if you have a little fiber somewhere that's flapping around in the joint space, they go and they basically cut it out and suck it out of the knee. And same thing with cartilage. Any loose cartilage in there, they actually scrape out, which again makes zero sense to us because we want the cartilage. Once that cartilage wears out, that's what arthritis is, right? So you walk out of that surgery with more arthritis than when you came in with it.
And again, I say this over and over and over and over and over. I love surgeons. I'm not bashing surgeons at all. They do the hardest work in medicine. My hat comes off to them. But I don't like the surgeries that most of them are doing. And I have known some surgeons that were good friends of mine that I would actually refer people to because they were averse to doing surgery unless it was needed. But that's not common.
Right. So at this point, will stem cells do anything for arthritis?
Yes.
And what can be done with a bone spur at this point?
I don't know that your bone spur is an issue.
Yeah, very rarely a bone spur is
I
an
don't
issue.
either.
It just says that, hey, we've had some arthritis that's been going on for quite some time. It's called an osteophyte. Really, the only time we worry about osteophytes is if they're actually growing within the joint space, which is incredibly rare. Most of the time, they're on the edge of the joint. It's not articulating with what's going on, so it's just something on the outside. But yeah, we really don't worry about those in the majority of cases.
Yeah, and you can see those when you look with an ultrasound.
Yeah, you can see them.
Because we look at both sides. If you have problem, let's say your right knee, we check out the left knee also where the person has zero pain, and we'll see osteophytes, we'll see meniscal tears, we'll see all kinds of things, but they're not pain generators. So we have to be very careful. The big term here is pain generator. What is causing your pain? It's not an image that causes your pain. So why cut the image? The surgeon feels great. He says, I fixed your image. But then the patient doesn't get better. So what's the problem with that?
Yeah,
So
and
what
again,
is
we
my
know
course
that
of
this
treatment
stuff
at this
regrows tissue. So you ask, does it, address your issues? It does. It's just a matter of, will you be somebody that gets pain relief, and then how many treatments would you need to get that sort of pain relief, which we can't guarantee that number or timeline, but we certainly see results with this.
And look, stay. The message is stay conservative. It's easy to walk in, get an injection, and walk out. That's regenerative medicine with platelets and stem cells. It's not easy to get a surgery. And a lot of people get this confused because they have this idea that a surgery is an end point to their treatment. I'm going to go in Tuesday, I'm going to get it done, and I'm going to be fine. But we get all the people where it failed on. It's called like a failed back syndrome, a failed knee syndrome. Those are actual diagnoses. That means that it's happening all day long for the insurance company to create a diagnostic code for it. It's time, to wake up. I mean, people are waking up, but medicine moves slowly, and the doctors, are trained a certain way, certainly don't want to move into something that they are not up on. And I always say this, when a doctor is not up on something, he is down on it. Dr. Grove and I are open-minded. There are people we send to surgery. It's rare, but it happens. I don't get a lot of doctors sending me patients to have stem cells or PRP.
Right.
Mm-hmm.
Why?
Well,
Why
it
is
was
that?
miraculous. I had labrum, bicep, and rotator all in my left shoulder, and with 3 injections from you, I was like 80% better. So
well, that's
I'm
what we're
believer.
looking. That's what we're looking for 100%. So if you only got 80% better, I failed you. I apologize.
Yeah, but I mean, I'm 71, so I'm not expecting perfection at this point. The body's kind of wearing down.
Well, I'm going to be honest with you, Stephen. I expect perfection. I'm 76, and I still expect perfection. I don't believe in aging. I think that's a mental thing, and I'm not putting you down for the way you think. Everybody's entitled to the way they think, but we can get people 100% if they want to stick with it. It's just a question of how determined is a person. Like I heard a guy say, I want to get to God. And this very wise man said, well, what are you willing to do that? And the guy said, well, I don't know. What do I have to do? And the wise guy said, you ever been underwater and you need that next breath and you're willing to do anything to get that next breath? And the guy goes, yeah, I've been underwater. I know that feeling. He said, that's what you have to do to get to God. You've got to want it more than anything else. And healing is the same thing. Mm-hmm. You got to want to heal. It's not some magical process. You got to put in the time, the energy. We have people who have like 3-story houses. They'll get their knee or their hip or their foot injected by us, and we say, don't do the stairs. And they go, but I have to do the stairs because my kitchen is upstairs or blah, blah, blah. And I say, I have patients who move something downstairs, they put a futon on the first floor, or they'll go to the gym to take a shower instead of walking up the stairs. They're dedicated. How dedicated are you? So that 80% that you got in your shoulder when I injected you, that's great. And maybe you're satisfied with that. But the next guy might say, I want 100%. He might be more dedicated to his healing. He may need more injections. We just don't know. Everybody's different. We're here to make people happy. We're here to love people. That's the main thing in medicine. And I got in trouble for that when I got to medical school. The first day of class, we were all together in a room, and the director of medicine got up in front and he goes, what is a doctor? And no one raised their hand except me, because I'd been a lawyer before and I talked a lot. You can't get me to shut up. And he said, okay. And they called us doctor from the first day, which was kind of cool. And he said, okay, Dr. Darrow, what is a doctor? And I said, a doctor is a minister. And he started laughing so hard he almost fell over. And then the rest of the class started laughing at me. Now, I don't mean a religious minister. I mean someone who's ministering to people. Okay? Does that make sense to you? And my job, I always knew I wanted to be a doctor to make people happy. That's ministering to people. How I did it, I didn't know yet, because I didn't know which path I was going to take. So,
I just want to be able to squat and to be able to see which way the putt's going to go. I
get you. And you know what? You're invited to come to Mountain Gate with me later today if you want to hit some balls. That's where I'm going.
not today, but maybe some other time. And I'll bring you over to Braemar so you can see what that has to offer.
Yeah, I've played there a few times. I love it. It's a nice, tough course, very much like Mountain Gate. Yeah.
Very much like Mountain Gate.
Yeah, we can. You come to mine, I'll come to yours. That's the way we usually do it. But anyway, there's,
I'll call for an appointment, and I want to get the ultrasound done because the X-ray that the doctor showed me, I don't know what I'm looking at, but he made a big case for the fact that there was not enough space between the upper and the lower part of the knee. And that's why I'm having this problem, and why surgery.
Well, it just means the cartilage is worn down when the bones get close together. But there are many X-rays that we've done before and after that actually show cartilage growth. It shows that space between the bones actually gets bigger.
Yeah, plenty level of evidence showing that this stuff actually regrows cartilage over time. Yeah, no question.
And what about the arthritis? Isn't that degenerative?
Not necessarily. I mean, it can be. But there's nothing in the book that says, there's no Bible of medicine that goes, if this, then that. Darn it. Hey, Hector, I'm sorry we didn't get you. Call the office. Talk to them. The number at the office is 800-300-9300. That's 800-300-9300. There was a problem with his hand, which we treat all the time. Go to the website, www.jointrehab.com. Watch videos of us doing these procedures. And email us from every page there. God bless you all. Thank you so much, Dr. Thomas Grove. You're a miracle worker.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate. Don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.